Many of you know that CMU is the most international of all the top 50 universities in the world. Look around the room, it's like the United Nations. But we also have outposts in different countries around the world. CMU Qatar, CMU Portugal, that foreign land, CMU Silicon Valley. We also have CMU Africa represented today. We have two teams that are going to be piping in from Kigali, Rwanda, where CMU Africa is. The first two will be online, and then the remaining 11 for the afternoon will be in person. So the first, did we check me showed up? All right. We didn't think these guys were going to show up, so they are right on time. So without further ado, let's hand it to Check Me Limited.
Hi, can you hear us?
We can hear you, yes.
Okay. Are we starting?
Please start.
Hi, my name is Yuyun Berinyuy. I'm going to ask you guys a question today. Has anyone lost somebody as a result of breast cancer? So here's my story. In 2023, I lost my elder sister to breast cancer. Sorry. Sorry, can you see our screen?
Yes.
Oh, sorry. So in 2023, I lost my elder sister to breast cancer. She was 40 and she died, leaving a son behind as a single mom. Having gone through a series of aggressive chemo and had her breast cut off and all the resources put in place, we couldn't still save her. This was because she was diagnosed at stage 4 cancer. In Africa today, 70% of these breast cancer cases are diagnosed at this stage, reducing their chances of survival. And that is why Global can give us these statistics. About 193,000 cases were recorded in 2022 and are projected to double by 2045. And this led to 91,000 deaths, and they're projected to be doubled by 2045 as well. So that is why today we're introducing CheckMe. We're building an AI-powered breast screening platform, which is integrated with an African-made ultrasound device that is non-invasive, accessible, and affordable, and accessible, especially to women living in underdeserved communities. CheckMe today is not just building a platform. We are building a community where no woman is being left behind. And over the past few months, through our platform and community engagement, we've been able to reach over 400 women. And our goal is to increase early detection rate by 40% in our target market within 5 years, potentially save 500 lives annually through early intervention. And we're doing this by combining AI-powered screening, education, and community support. So what is our target market and what is our competitive analysis and what makes CheckMe different? Affordability and accessibility. We're providing an alternative to early detection and screening in underdeserved communities, AI-driven insights. With our AI, we're leveraging AI to analyze ultrasound images and provide proper risk assessment and management. Scalability and portability. We're providing, with our lightweight device, we are promoting remote screening while supporting mobile clinics and community campaigns. So now let's look at our target market.
Thank you, Francis. So moving on to the market, CheckMe intends to target a very good market in Africa, beginning with our total addressable market, which is $3.8 billion, and moving into a sub-Saharan African part, which we intend to target approximately $2.9 billion. And initially where we have started, where our serviceable obtainable market is, which amounts to approximately $410,000. Then moving on to the next, we intend to have device sell our device directly to hospitals in both rural areas and urban areas, which they can't afford to buy a mammogram. And at the same time, if they won't be able to afford the price to buy, then they can rent our device by $100 per month. And we intend to have, in our community engagements platform, we intend to have $5 subscription per month for each and every woman who would like to be subscribing for consultations, and have appointments with the healthcare experts directly. And these are our financial projections, where in the next 5 years, we intend to have raised approximately $560,000 and with an initial sales of $170,000 with a 30% compound annual growth rate with inclusion of churn rates. And this is our plan to penetrate in the market, where we plan to gain partnerships with the government and non-government organizations together with healthcare providers, expand into new markets inclusive of other African countries, and we intend to reach out to people via direct sales or our online platform. And this is our diverse team, where we are currently 5 of us, but we intend to add a hardware, someone who's going to help us with the hardware development, and also someone
Okay,
who's
we're
going
going to need
help
to
us
stop
with
right there and go to judges' questions. So judges, if you have questions, please speak into the microphones. Asha?
So you're trying to make your device sales very affordable and through rentals, but would the hospital be paying directly, or would be users? I mean, who would end up paying?
the healthcare providers are the ones who will be buying our device. That's our initial target customer.
This available to people who are not in close proximity to a medical clinic or hospital that can implement such a device?
Sorry, we didn't hear you
Sorry, we
correctly.
didn't hear you.
How do you make this available to women who are not living close to a hospital or a clinic?
That is why we are talking of, well, our outreach programs and community events that we've organized. So far, we have been able to do clinical screenings already in remote areas. So we go to these women, and if you remember, I spoke about promoting mobile clinics. That means with the hardware being lightweight and portable, without need of necessarily coming to a hospital, we visit these remote areas and we talk to the women and get them screened with our medical experts. Sorry, we can't hear you.
Now? Okay. Sorry about that.
Yes, we can.
I understand you're using AI to help with some of the image, but who would actually then review the image and make a diagnosis?
So with the power of AI and the way AI is advancing now, we are building in such a way that it reduces the time it takes to analyze these images, especially people who are not, we are looking at radiologists who can actually help us review these results so that our AI can become better, because we are looking not to so much depend on them, because remote areas cannot probably afford to pay a good radiologist. So with the local hospitals and their local doctors, our AI model could help them analyze these results, which also on our platform, we have health experts that were onboarding that would help analyze this further based on feedback, probably giving more feedback and making the AI much better to understand what actually, to understand and correct errors when necessary.
Okay, thank you.
I'm curious about other markets. I see that you're starting in Africa, and you were saying that your serviceable, attainable market's about $500,000. I'm wondering, China, India, have you thought about whether this also fits there, or maybe they have a different approach?
So currently, we're looking at Africa because it's like the birthplace of this problem. We want to leverage in the African market. We haven't looked at the other markets yet, but we're leveraging in Africa, and we spoke about expansion. Our goal is that once we are able to succeed with this in Africa, we'll now definitely expand to different areas and to different countries, even out of Africa. Because breast cancer is a global problem affecting all women worldwide.
Thank you.
So is the innovation the device and the business model? I mean, could you leverage other devices and then drive it through this unique business model, or do you actually need to do both?
Sorry,
Sorry.
we didn't get your question very well.
So you're creating a new breast cancer screening device from scratch, it almost appears, right? And I assume there's a lot of work that's been done in this field. That requires a lot of investment, time and resources and such. Do you need to do that, or could you leverage something that's out there and then really focus on just the business and distribution model and getting out into the communities and such? Like
Currently, we
if it's
don't-
truly unique what you're building, what sort of makes your device unique aside from the market?
So what we're trying to do now is we are building a prototype and then leverage with this prototype we're able to leverage the outside markets to help us actually complete the development, because we are just assembling it based on our studies. and
Okay,
then-
we're at time. We're at time.
Oh.
Thank you. Appreciate it, though. Thank you.
Thank you.